irritable? Do you feel more frustrated? Do you find yourself having a shorter fuse with your partner at work? Is your attention span, is it beginning to shorten? So there's so many different ways to kind of take a step back and kind of just check in with self.
And just from my own experiences, even like recently in seeking out, working for pharmacy retail gave me a little bit of anxiety. And so there was a point for a couple months where I did need to kind of talk through my feelings and get back to feeling normal and having normal feelings about things and not being worked up about certain situations. But there are people in the field that are believers also. They have their own religious beliefs, and you can actually, my counselor said, getting a therapist is like trying on a pair of shoes. Not everybody that you go into, or not everybody that you meet as a therapist might be the one that fits for you. You have to find that fit for you. And in saying that, there are therapists out there that I have Christianity faith. They have Christianity faith, and when you talk to them, they'll talk you through spiritually. Here's this Bible verse. Since we're talking about this area in your life, let's go look at that. So I don't want to discount that the shoe can fit. And you know what I'm saying? The shoe can fit. And there's definitely access to different types of people. If you prefer a male, if you prefer a female, if you prefer somebody that looks like you, whatever that looks like, there you have access to people that are like that. It doesn't have to be like that. That stigma doesn't have to be there.
And speaking of like seeking help, could someone please explain to our audience how one can go about finding a therapist from your experience? And maybe Dr. Tucker, you can provide some guidance.
Or even, I think before we even go there, Shamita, or with that, Dr. Tucker, if you could kind of talk about what one would need to be dealing with to say, you know what, maybe I should go talk to someone. And then where do I find that help? Because I think a lot of times things are happening in our bodies and we're not even aware of our feelings and emotions, because I think as a culture, I can speak personally for myself. The only feelings I knew was anger and happy. Like there were no other in betweens, right? And so as I became an adult, I realized what was happening in my own body. And I don't think some people are really self-aware to know what's going on that would trigger me to say, maybe I need to seek some therapy for this.
These are great questions. These are really good questions. I think there's so many different ways to kind of check in with yourself, right? To ask yourself, do I need to talk with a professional? And you're right. I think oftentimes we kind of get bogged down with happiness and anger. But how do you even begin to differentiate when perhaps you've been angry for so long, right? How do you begin to differentiate when you have held onto some resentment that has been a part of your body for so long that you're not even realizing that it's become this excessive, extremely unhealthy negative emotion that is kind of cascading or perhaps kind of setting off these other negative behaviors or feelings. And so before we kind of step into what those services, how do you access those services? I think one of the things I ask a lot of patients is, before they even become a patient, right? Have you been feeling tense, right? What is your stress level? Begin to think about some of those psychosomatic experiences. How are you sleeping? What is your eating habits like? Are you finding that perhaps you are an emotional eater? Are you finding that when you feel a certain way or a certain time of the day, or perhaps after certain events, do you find yourself kind of getting caught up in this cycle where you're reaching for perhaps alcohol or more sugar or fast foods? And again, I don't want to give fast food, alcohol, or sugar a bad name. But I think when you begin to kind of delve into these very unhealthy patterns of eating and sleeping and living, or are you snapping at your children? Do you feel more irritable? Do you feel more frustrated? Do you find yourself having a shorter fuse with your partner at work? Is your attention span, is it beginning to shorten? So there's so many different ways to kind of take a step back and kind of just check in with self, to ask yourself, like, what am I experiencing symptomology? What do my behaviors look like? What are my friends saying with me? Or what are they not saying? Are their friends saying, hey, listen, I don't know what's going on, but something has been off the last few days. And I don't know what it is, but it's something. So there's so many different routes, right? To kind of check in and ask yourself, do I need help? And then the question becomes, what type of help do I need? Does it make sense?
Yes.
Right. Yep, it definitely does.
Absolutely. That was so great. And like, I think it's a growth process that we have to get to be able to check in with ourselves and say, what am I feeling? What am I feeling and where is that feeling coming from? And then I think that back to Dr. Shamita's question is like, so then what's that next step? Where do I look? I will say for me in my personal journey, my first therapist that I saw was through EAP, an employee assistance program. So there are a lot of companies out here, you guys, that they have an employee assistance program and it's free for you. So my company had 6 sessions that were free and I didn't even feel like I needed a therapist. I was just like in a year, 2018, I decided my word for that year was intentionality. And I decided, listen, I don't know everything there is to know. Maybe I need to seek out some other people who are very expert in their specific area and just give it a try. So I made an appointment with a therapist just to give it a try because it was free. And I said, I'm paying for all these benefits. Let me go and enjoy this benefit. So I just scheduled an appointment. I went in and I will tell you the first session, I was telling her everything that I was, just doing. And she was like, that's a lot. And it was her telling me that was a lot before when I started thinking like, maybe this is a lot. I don't know. It's just been life, right? You just get, especially as a pharmacist, we get caught up on this treadmill of life and trying to climb this career ladder. The first time it was like, oh, that was really actually kind of cool. The second time I went though, after a box of tissues, I was like, I needed this. This was actually very cathartic. And I continued to go because I didn't realize the value of just having somebody sit across from me, ask me some very reflective questions, and me becoming self-aware of my triggers, me becoming self-aware of the things that I'm doing that may not be serving me well, and me becoming aware of environments that I was in that were not serving me either. So Dr. Turger, can you talk a little bit about where do I seek services? How do I find a therapist?
And then when also Dr. Tucker, can you keep, our community in mind, because especially the community that may not have a lot of money or a lot of financial resources to get the help they need. Are there any free services that they could take advantage of as well?
Absolutely. First, I want to just say, Dr. Johnson, you were spot on. You actually, you identified, I think, one of the most underutilized resources that there are, that does exist, employee assistance programs. That is a great way to kind of kick off your therapy journey, to kind of kick off your self-care journey. And that's what I like to call it. It's self-care. It isn't just about therapy and mental health services. It's about your personal self-care and wellness plan. And I think those employee assistance programs provide so many different free visits. Dr. America, you mentioned keeping our communities in mind. And so if your employer offers EAP services, or perhaps you may not even be aware of it, ask them, do they offer EAP services? Because most employers do. Your second question is, how many visits? Is it 3, 6? There's some companies that offer 8 visits. And then also, once you do exhaust those 3, 6, or 8 visits, don't hesitate to ask for additional services, for additional sessions. There are some organizations that would say, you know what, now that you have addressed this issue, are there any other issues that you need to address still using your free EAP benefits? And so oftentimes you can get up to 16 or 20 free sessions before you even begin to access your health insurances if you have that, or perhaps pay out of pocket if you have that. If you're comfortable with your EAP provider, because guess what, now that you've shared all of these raw, vulnerable emotions with this one person, do I want to bounce around from one therapist to another? What I call therapy hopping. Do I want to really start, sharing my story with 3, 4, 5 different people and starting all over, every 2 months? It can become so exhausting And it'll make you want to just walk away from therapy altogether and just go back to whatever you were doing to deal with your issues. Then the question becomes, hey, do you offer out-of-pocket, sliding scale fees? If I can pay this amount out of pocket, is this something that you're willing to work with? And to be honest with you, you don't really know until you ask, right? So asking is an opportunity to learn more, but also asking this therapist, do they offer a sliding scale fee, is an opportunity for the therapist to say, you know what, this is how I can support you financially, as I'm also supporting your personal self-care and wellness journey. Another resource is Psychology Today, right? I think many folks are aware of, perhaps may not be aware of actually, when I think about it, psychology. You just type in or just Google Psychology Today. You can put in your zip code of where you live, and it'll give you a very comprehensive list of therapists in your area that accepts your insurances, or perhaps therapists that offer a out-of-pocket sliding scale fee. And then also therapists who provide pro bono services if that's something that you need as well. So that's another great resource that I don't want to say is underutilized, but I think you have to be really skilled in how do you put in those particular like key search terms or words that you're looking for. There is still a shortage of African American male therapists, and so that is something that you're looking for as well with Psychology Today. When you type in African American male therapist, I might show up. That's a possibility. But to be very honest with you, and this is something that as a field, as a behavioral health, we need to continue working on. There's not a lot of people that look like me providing therapy, but there's a lot of folks that look just like me who want and need individual, family, and couples therapy. So I am hoping that we can continue to train young African American men to become therapists, because there's a tremendous shortage out there. So that's slightly off topic, but I think at the same time, when we start talking about how to access services and where to access services, I also want to kind of highlight what you're more likely to find and perhaps what you're least likely to find as well.
Mm-hmm. And also for, if we had I think most of our audience are adults, but if we have younger adults or teens watching it, I know that you can get some type of service in the schools as well, in high school and maybe in the elementary or middle schools. They have guidance counselors who can really assist you and provide those services. And sometimes they may even pull the child, depending on how serious it is, they may even set up a time where they can just pull the child out to have a session. And then colleges will also have therapists that you can talk to for free, in case college students don't have any insurance, or for whatever reason they can't be on their parents' insurance.
I think, yeah, that's definitely, I agree, Dr. Mariko, that there are so many avenues for younger people to seek therapy and services. But Dr. Tucker, you raised a really excellent point in that there is a challenge with access, but then there is that challenge of, can I find a therapist that is going to identify with me and maybe some of the social determinants of health that I deal with, right? And I think for me, the most important thing that was a breakthrough for me in my EAP journey with my organization is the fact that there was a Black woman therapist there. And I specifically asked for her. And I think that meant the world to me, because I had somebody that could really identify a little bit with what my journey and what I was going through at that time. And so you bringing up the fact that there's a shortage of African-American male therapists, there's a shortage of African-American male fill in the blank, right? And I think that's not at all off topic, because we all have to do our personal work and we all have to do our journey. And I have run into more African-American males who have been doing that work, and they have done like their own personal journey. A lot of times after they've gone through some traumatic experience, say a divorce, or, their father just, or mother comes back into their life. So they have some type of event that has caused them to now look into therapy. But can you talk a little bit more about, is there any research or any studies that says someone might do better with a therapist that, you know, has the same cultural background as them, as opposed to someone that may not be able to resonate with their cultural background?
Absolutely. I would say the most powerful force in the therapy room is the relationship between the therapist and their patient, or the therapist and their client, the relationship. And there is some research. In fact, there's extensive research that supports how the relationship is actually the most defining factor in determining how much better a patient is able to cope with their stressors, or progress with their symptoms, or reach their goals. So the relationship is beyond critical. Like, to say is critical or important is a tremendous understatement, right? And then there's also a ton of research that talks about how having that level of cultural competency and that level of cultural comfort, like comfortability with the person that you're working with, their ability to relate to you, their ability to understand what you're referring to without you having to translate or interpret or explain, or perhaps even over explain. I mean, imagine being in a therapy session and not only are you dealing with whatever you brought to the therapy session, but now you have to explain or interpret or educate who's taking care of who now, right? Do you feel as if you're still the patient, or do you feel that you're working more to help your therapist understand where you're coming from, right? I had a gentleman that was actually driving to Raleigh from Richmond, Virginia, once a week for therapy. And when I was in private practice outside of Charlotte,
for our audience who may not be in North Carolina, give us some perspective. Like, how far is that?
We're talking about what, 2 hours minimum, 2+ hours. And it isn't just a Raleigh issue. When I was working outside of Charlotte, I had a patient driving from Spartanburg, South Carolina, to my practice in Gastonia, which is about an hour, perhaps an hour and a half. And so we're talking about a tremendous shortage. But at the same time, what comes to my mind is the extent folks are willing to go to get what they need, right? And what people are saying is like, listen, I know that I need this. I know what's going to feel right for me, and I'm willing to drive if it means an hour and a half. I've had so many individuals that would drive their 16, 17, 18-year-old boys to my office, 90 minutes, perhaps even 2 hours, because they were looking for someone who understood their culture, understood what they were coming from, understood when they say, you know what, I'm a student at ECU, you understand what that means, right? I am a student at NC State University. These are some of my challenges. I know exactly what you're going through, right? Even as someone who was a lecturer and who was an employee there. I mean, it's just, there's so much to speak about the importance of cultural competency, cultural sensitivity, but at the same time, relatability.
Yeah, I think, Dr. Tucker, I cannot thank you enough. You're such a wealth of wisdom. And I would love, I'm going to already tell you, I'm speaking for me and the ladies, we need to have you back for sure, because I just think this is such great conversation to be had. And the historical perspective, I think, is so important for people to understand how we got here. Really, just how did we get here and how do we move forward? And a lot of that growth to move forward is us being able to meet our basic needs. And then, like you said before, how do I now become the best version of myself?
Yep. And being able to have these open conversations that we're having, I think.
Yeah, and not feel bad about it.
Not feel bad about it.
Right. Excellent. So empowering. It really is.
So the audience for tuning in to another episode of That Pharmacist Show. Please stay tuned for our additional shows in the future. Like we mentioned, hopefully we'll have a part 2 to this episode. And don't forget to like, comment, and share. And talk to you soon.
Thanks so much. Thanks for watching.